Have you ever wondered how childhood obesity impacts health? New research uncovers significant findings about high blood pressure in kids. Let's dive into the details and understand the connection. Recent data reveals that children with obesity or severe obesity face a higher risk of high blood pressure. This groundbreaking study involved nearly 1,000 children from Philadelphia. The lead author, Patrick Faherty, aimed to quantify the link between obesity and blood pressure in children. The study analyzed data from youth community screenings conducted between 2023 and 2025. Researchers looked closely at systolic blood pressure and BMI among 920 children aged 3 to 18. This age group included around 70% of children aged 14 to 17. Participants were categorized based on their blood pressure levels and BMI. The categories included underweight, normal weight, overweight, obesity, and severe obesity. Results showed only 17 participants were underweight, 414 normal weight, 156 overweight, 268 obese, and 65 severely obese. Key findings indicated that children with obesity were over 2 times more likely to have high blood pressure. Those with severe obesity were nearly 4 times more likely. In contrast, children classified as overweight showed no significant increase in high blood pressure risk. The researchers employed age-specific guidelines from the National Heart, Lung, and Blood Institute. These guidelines identified a higher number of children with elevated blood pressure compared to simpler, static guidelines commonly used. Future studies are vital to understand the relationship between BMI and blood pressure better. Examining additional factors could provide more comprehensive insights into this condition. Faherty expressed surprise at the lack of significant evidence linking being overweight to elevated blood pressure. This suggests a specific BMI threshold might exist before blood pressure shows consistent increases. For healthcare professionals, these findings highlight the crucial need for interventions against childhood obesity. Faherty emphasized that with the risk of high blood pressure significantly increasing, proactive measures are essential. Dr. Tim Yos underscored the importance of reducing childhood obesity as cardiovascular disease is a leading cause of health issues in adults. He reiterated that these results were expected but emphasized that the lack of significant findings for overweight children was unexpected and worth investigating further. Despite limitations, such as the inaccuracy of BMI in some cases, the study calls for priority attention on childhood obesity. Addressing this crisis is key to improving long-term health outcomes for children as they grow into adulthood. In summary, the link between childhood obesity and high blood pressure is clear. With obesity elevating the odds of hypertension, interventions are critical. We must prioritize reducing childhood obesity for healthier futures. If you found this information helpful, share it with others and let's spread awareness about the importance of tackling childhood obesity today.